Welcome, everyone. I'm excited to introduce you to our professional diploma program in Counseling Companion for Addiction Practice. Today, we'll be exploring the different phases of this comprehensive training. We'll start with Phase 1, Science and Models, then move through Ethics and Role in Phase 2, Skills and Support in Phase 3, and finally, Practice in Phase 4. I'm looking forward to guiding you through this journey and sharing how each phase builds upon the last to enhance your skills and knowledge. Let's get started. Let's take a closer look at what we'll be focusing on in this course. First, we'll explore how to apply recovery frameworks. These are essential as they provide structured approaches to support individuals on their recovery journey. Then, we'll dive into understanding the science of addiction. Knowing how addiction works helps us tailor our support more effectively. Next, we'll work on mastering support skills. These are the practical tools and techniques you can use to genuinely connect and assist others. And finally, we'll review the course objectives, ensuring we're all aligned on what we aim to achieve together. Overall, these key points form the foundation of our approach, helping us create a compassionate, informed, and effective support system for recovery. Let's take a closer look at some of the different types of dependencies. When we talk about process addictions, we're referring to behaviors like gambling, gaming, and shopping. These are activities that can become compulsive and hard to control, much like substance use. On the other hand, we have chemical dependencies, which involve substances such as opioids, alcohol, and stimulants. These dependencies directly affect the brain's chemistry and can lead to serious health issues. It's important to recognize that both substance and behavioral dependencies are interconnected under the broader category of dependencies. Understanding these distinctions helps us see the full picture of addiction and the various ways it can manifest. Throughout this presentation, we'll explore how these dependencies impact individuals and what can be done to address them effectively. Now, let's take a closer look at the different factors that influence mental health through the lens of the biopsychosocial model. On this slide, we see three key areas: social, psychological, and biological. Starting with the social aspect, environment, family, and peer influence play a significant role. Our surroundings and relationships can impact how we think, feel, and cope with life's challenges. For example, a supportive family or a positive social environment can promote resilience, while stressful or toxic environments can contribute to mental health struggles. Moving to the psychological side, trauma, coping mechanisms, and mental health itself are crucial. Past traumatic experiences can leave lasting effects, influencing how we process stress and emotions. The way we cope with these experiences can either help us heal or exacerbate issues, highlighting the importance of mental health support and resilience building. Finally, on the biological front, genetics and changes in brain chemistry are fundamental. Our genetic makeup can predispose us to certain conditions, and shifts in brain chemistry can affect mood and behavior. Understanding these biological components helps us recognize that mental health isn't just about thoughts and environment, it's also deeply rooted in our biology. Overall, this slide underscores how interconnected these factors are, reinforcing the idea that mental health is complex and multifaceted. Recognizing this helps us approach mental health with compassion and a comprehensive perspective, which is essential as we continue exploring more about prevention and treatment. Today, I want to talk about the core stages of recovery, which are crucial in understanding how change happens. These stages are pre-contemplation, contemplation, preparation, action, and maintenance. Each of these steps represents a different phase someone goes through when making a change, and recognizing where a person is in this process can really help tailor our support. Starting with pre-contemplation, this is when someone isn't yet considering change, sometimes because they don't see the problem or aren't ready to face it yet. Then moves contemplation, where they start to acknowledge there might be an issue and begin weighing the pros and cons of changing. Next is preparation, a stage where they're getting ready, making plans, gathering resources, and setting goals. After that comes action, which involves actively making the changes in their behavior. And finally, maintenance is about sustaining those changes over time, preventing relapse and reinforcing new habits. Understanding these stages helps us meet individuals where they are in their recovery journey, making our support more effective and compassionate. It's a continuous process, and recognizing these phases can really make a difference in guiding someone toward lasting change. Addiction is a medical condition, not a moral failing. This is a crucial point to understand because it shifts how we view and treat those affected. Many people still believe addiction results from a lack of willpower or moral weakness, but that's actually a misconception. Addiction involves complex changes in the brain, and it requires proper medical treatment and support. When we talk about myths and stigma, we're addressing these harmful beliefs that can prevent people from seeking help or receiving compassion. Recognizing addiction as a medical issue helps reduce shame and encourages a more empathetic approach. By understanding this, we can foster a more supportive environment for recovery and challenge the stereotypes that often surround addiction. Remember, it's not about moral failure, it's about health and recovery. Let's talk about the importance of a consistent presence. Being there regularly helps build trust and a sense of security. An ally, whether it's a caregiver or support person, plays a crucial role in this process. Monitoring for crises is also key, staying alert to signs that someone might need immediate help so we can respond quickly. Ensuring safety is always a top priority, creating an environment where individuals feel protected. Providing help with daily routines can make a big difference, things like managing schedules or activities that promote stability. Establishing structure helps create predictability, which is especially comforting in uncertain times. Emotional validation is equally important. Acknowledging how someone feels without judgment helps them feel understood and supported. Support, in all its forms, is the foundation of effective companionship. The role of the companion is to be a constant, trustworthy presence, someone who monitors, supports, and validates emotions. By doing this, we foster a safe space where individuals can thrive and feel truly understood. This consistency and support are what make a real difference in their well-being. On this slide, I want to emphasize some important boundaries for companions providing support. First off, companions do not offer psychotherapy. That means we're not trained mental health professionals, and we're not there to diagnose or treat mental health conditions. Similarly, we don't provide medical prescriptions or clinical diagnoses. Our role is purely supportive and non-clinical. This is crucial because it helps set clear expectations about what support is appropriate and safe. Our scope of practice is limited to offering companionship, empathy, and encouragement, but not formal therapeutic interventions. By understanding these boundaries, we ensure that we're acting within our capabilities and respecting the professional roles of licensed clinicians and healthcare providers. Connecting this to the overall theme, it highlights the importance of maintaining ethical and professional standards while offering meaningful, non-clinical support to those in need. Now, let's take a closer look at some of the key roles involved in providing support. When we talk about a shared experience, we're referring to the connection that develops when someone genuinely understands what you're going through. A peer is someone who has walked a similar path and offers daily support, acting as a companion who's there consistently. This peer support is powerful because it's built on shared understanding and trust. Moving on, skill building is another crucial aspect. It involves developing coping strategies and life skills, often with the help of a counselor. A counselor is someone who provides guidance, helps navigate challenges, and supports mental health on a more clinical level. They may work with individuals who have specific clinical diagnoses, which are formal mental health conditions identified through assessment. Therapists, on the other hand, might focus more on therapeutic techniques and emotional healing. While all these roles aim to support well-being, they have different functions. For example, a peer offers daily, relatable support, a counselor provides structured guidance, and a therapist works through deeper emotional issues. Understanding these differentiating roles helps us see how each contributes uniquely to a person's journey toward mental health and resilience. Recognizing the distinctions ensures we connect individuals with the right type of support, tailored to their specific needs within this broader framework. Now, let's talk about some key principles that help us maintain healthy boundaries. First, limited self-disclosure. This means sharing only what's appropriate and necessary, avoiding oversharing that could blur the professional line. It's about being open enough to build trust, but not so much that personal details interfere with the relationship. Next is no financial involvement. In our work, it's essential to keep financial matters separate to prevent conflicts of interest or misunderstandings. This helps preserve objectivity and professionalism. Then we have no dual relationships. That's when our professional role overlaps with personal relationships, which can create complications or biases. Avoiding dual relationships safeguards both the client and our integrity. All these points tie back to the overall theme of maintaining healthy boundaries. By adhering to these principles, we create a safe, respectful environment that promotes trust and effective support. Remember, clear boundaries are fundamental for ethical and effective practice. Protecting client information and maintaining their dignity is absolutely paramount in our work. When we talk about confidentiality, we're emphasizing the importance of respecting the privacy of the people we serve. It's not just about following the rules, it's about building trust and ensuring that clients feel safe and valued. This means being careful with their personal details, only sharing information with those who need to know, and handling all data securely. Remember, safeguarding confidentiality is a core part of our professional responsibilities and directly connects to the overall goal of providing respectful, ethical care. By doing so, we uphold the integrity of our work and reinforce the trust clients place in us. When we talk about sensitivity, we're emphasizing the importance of being aware of and responsive to the diverse needs and experiences of the individuals we serve. Culture plays a crucial role here. Understanding and respecting cultural differences helps us build stronger connections and deliver more effective care. Client autonomy is also key. It's about empowering individuals to make their own choices and respecting their right to self-determination. Choice goes hand in hand with autonomy. Giving people options fosters a sense of control and dignity. Transparency is essential, too. Being open and honest about processes and decisions builds trust and reassures those we support. Trust is the foundation of any effective relationship, and it's cultivated through consistent, respectful, and honest interactions. We also need to consider physical and emotional safety. Creating environments where people feel secure and supported is non-negotiable. Trauma-informed care ties all these elements together. It's about understanding trauma's impact and ensuring our approach minimizes re-traumatization while promoting healing. Altogether, these points reinforce our overarching goal: to provide compassionate, respectful, and effective care that prioritizes the well-being and autonomy of every individual we serve. Now, let's talk about active listening, which really ties into the overall theme of effective communication. One of the most important aspects is giving our full attention to the speaker. That means eliminating distractions and truly focusing on what they're saying. Paraphrasing is also key. It shows we're engaged and helps ensure we understand their message correctly. When we restate what they've said in our own words, it confirms we're on the same page. Another crucial point is emotional validation. This involves acknowledging and respecting the speaker's feelings, which fosters trust and connection. When we validate emotions, it encourages open and honest dialogue. All of these components, full attention, paraphrasing, and emotional validation, work together to create a supportive environment where communication is genuine and effective. They're essential tools that help us build stronger relationships and enhance understanding, which is at the heart of everything we're aiming for in this presentation. Let's take a moment to look at some key elements that support effective communication. First, we have summaries, which help us consolidate and clarify the main points of our conversation. Reflections are also crucial. They involve paraphrasing what the other person has said to show understanding and encourage deeper discussion. Affirmations are about recognizing and reinforcing positive behaviors or statements, helping to build confidence and rapport. Open questions are essential, as they invite more detailed responses and foster engagement, rather than yes or no answers. Now, connecting all of these is the OARS framework, which stands for open questions, affirmations, reflective listening, and summaries. It's a core structure in motivational interviewing, a technique designed to enhance motivation and facilitate change through empathetic dialogue. Throughout this presentation, we've seen how these elements and frameworks work together to create a supportive, collaborative environment. They help us listen more intentionally, understand our clients better, and guide conversations toward meaningful change. Creating safety through acceptance and radical empathy is really at the core of building trust and openness. When we talk about a non-judgmental space, we're emphasizing the importance of creating an environment where everyone feels truly safe to express themselves without fear of being judged. It's about actively listening and showing genuine understanding, even if we don't always agree. This approach allows people to open up more honestly and helps foster deeper connections. By cultivating acceptance and radical empathy, we create a foundation where vulnerability is welcomed, and that ultimately leads to more authentic interactions. Remember, when people feel accepted and understood, they're more likely to engage fully and contribute to a positive, supportive environment. This idea ties back into our overall goal of creating spaces where safety and trust are prioritized through compassion and understanding. When we talk about building trust, three key elements come into focus: consistency, reliability, and authenticity. Consistency means that the information we provide remains steady over time, helping others feel confident that they can depend on what we share. Reliability is about being dependable, following through on promises and delivering quality work consistently. And authenticity involves being genuine and transparent, which helps establish a real connection with others. These principles are the foundation of trust, which is essential for any strong relationship, whether it's personal, professional, or within a larger community. When we prioritize these qualities, we reinforce our credibility and foster an environment where trust can truly flourish. Remember, trust isn't built overnight. It's cultivated through ongoing actions that demonstrate these core values. This aligns perfectly with our overall goal of effective communication and strong leadership. Let's talk about supporting autonomy first. It's really important to respect the individual's right to make their own choices and to feel in control of their change process. When we validate conflicting feelings, we're acknowledging that it's completely normal to have mixed emotions, like wanting to change, but also feeling hesitant or unsure. This validation helps build trust and comfort. Next, exploring the pros and cons is a practical way to help someone weigh their options. It encourages reflection and clarifies their motivations and concerns. Remember, ambivalence, those mixed feelings, is a natural part of the change process. It indicates that someone is considering both sides and is often a sign that change is possible. Finally, managing ambivalence means guiding people through these conflicting feelings with patience and understanding. It's about creating a safe space where they can process their emotions without feeling judged. By doing so, we support their autonomy and help them move toward making confident, informed decisions, something that aligns perfectly with the overall theme of empowering change. Understanding the spectrum from substances to digital habits is really about recognizing how different behaviors and substances can impact us in similar ways. When we talk about addictive behaviors, we're referring to a range of actions that can become compulsive, even if they don't involve substances like drugs or alcohol. It's important to see that addiction isn't just about substances. It's also about the habits we develop, especially in today's digital world. These behaviors can hijack the brain's reward system, making it hard to resist the urge to engage repeatedly, even when we know it might be harmful. By understanding this spectrum, we can better appreciate how diverse addictive behaviors are and how they share common features, like craving, loss of control, and continued use despite negative consequences. This perspective helps us see that addiction is less about the specific substance or activity and more about the underlying processes in the brain. Recognizing this connection is key as we explore ways to prevent and treat these behaviors, whether they involve substances or digital habits. When addressing addiction along with mental health issues, such as depression, anxiety, or PTSD, it's really important to understand that these conditions often occur together. This is what we call co-occurring disorders or dual diagnosis. Essentially, a person might be struggling with substance use problems and simultaneously battling mental health challenges. Recognizing this connection is crucial because it impacts how we approach treatment. Treating one without addressing the other can lead to less effective outcomes or relapses. So, when we talk about recovery, it's about a comprehensive approach that considers both addiction and mental health as interconnected issues. This holistic perspective helps us support individuals more effectively and foster lasting recovery. Let's take a closer look at some common emotional triggers. First, we have sensory triggers, which include smells, sounds, or visuals. These are often the most immediate and powerful because they directly engage our senses. For example, a particular scent or a specific noise can instantly bring back a strong memory or emotion. Next, there are external triggers, which involve places, people, or events. These are the situations we encounter in our environment that can influence our emotional state. Being in a certain place or around certain individuals might evoke feelings of happiness, frustration, or anxiety, depending on the context. Then we have internal triggers, such as stress, loneliness, or anger. These originate from within us and are often linked to our internal thoughts and feelings. Recognizing these internal triggers is crucial because they can lead to emotional reactions that might be disproportionate or unexpected. Overall, understanding these different types of emotional triggers, whether they stem from our senses, our environment, or our internal states, helps us manage our responses better. This awareness is a key step in emotional regulation and resilience, which ties back to the broader theme of emotional awareness and personal growth throughout this presentation. When we talk about family recovery, support is absolutely essential. It's about creating an environment where everyone feels safe and understood, which ultimately fosters healing. Setting healthy limits is a key part of that. It's about knowing where to draw the line to protect your well-being and to promote respectful interactions. Boundaries help define what's acceptable and what's not, and they're crucial for maintaining healthy relationships. Enabling behaviors can sometimes seem helpful on the surface, but often they perpetuate issues rather than resolve them. Recognizing and addressing enabling is important for fostering genuine recovery. This leads us to the concept of codependency, which can develop in family dynamics when individuals overly rely on each other in unhealthy ways. Understanding these patterns allows us to break free from them and promote healthier, more balanced relationships. All of these elements, support, boundaries, enabling behaviors, codependency, are interconnected. They shape the overall family dynamics, which play a significant role in recovery. When we work on these aspects collectively, we create a stronger foundation for healing, growth, and sustainable change within the family unit. Recognizing emergencies and following referral protocols is a crucial part of crisis awareness. When we talk about recognizing emergencies, we're really focusing on being alert to signs that something is wrong, whether it's a sudden change in a person's behavior, physical symptoms, or a situation that seems unsafe. The key is to stay attentive and trust your instincts. If something feels off, it's important to take it seriously. Once an emergency is recognized, the next step is following referral protocols. This means knowing exactly what procedures to follow, who to contact, and how to ensure the individual gets the help they need quickly and effectively. It's about having a clear, step-by-step process in place so that no time is wasted and no details are overlooked. This process is vital because it helps us respond appropriately and efficiently, minimizing harm and ensuring safety. Remember, recognizing the signs early and following established protocols are central to our overall goal, creating a safe environment for everyone. It's all about being prepared, aware, and acting swiftly when it matters most. Let's take a moment to look at the difference between abstinence and harm reduction within recovery models. These are two distinct approaches to supporting individuals on their journey to recovery. Abstinence focuses on completely stopping the substance use, which is often the goal in many traditional recovery programs. It emphasizes total abstinence as the key to health and well-being. On the other hand, harm reduction recognizes that for some people, abstinence might not be immediately achievable. Instead, it aims to minimize the negative consequences associated with substance use. This approach can include strategies like safer use practices, medication-assisted treatment, or reducing the frequency and amount of use. Both models are valid and serve different needs, depending on the individual's circumstances and goals. Understanding these differences helps us appreciate the diversity of recovery pathways and the importance of personalized support. Connecting this back to the overall theme, it's about meeting people where they are and providing approaches that respect their choices and promote their health and safety. Let's explore some of the key approaches to recovery and self-management. First, we have mindfulness and meditation, which are powerful tools for staying present and managing stress. They help us observe our thoughts and feelings without judgment, fostering a sense of calm and clarity. Next is refuge, which often refers to creating a safe space or seeking shelter in supportive environments during challenging times. We also see CBT-based self-management, which stands for cognitive behavioral therapy. This approach focuses on recognizing and changing unhelpful thought patterns and behaviors, empowering individuals to take control of their recovery process. The SMART approach is another strategy, emphasizing goals that are specific, measurable, achievable, relevant, and time-bound, helping to create clear, actionable plans. Then we have programs like AA, NA, and other spiritual paths. These are rooted in shared experience and community support, offering a sense of belonging and understanding. The 12-step model is well known for guiding individuals through a structured process of recovery, emphasizing honesty, accountability, and spiritual growth. Finally, there's the recognition that 12-step programs can be complemented with alternative approaches, giving people options that best suit their unique needs and beliefs. Overall, these varied strategies highlight that recovery is multifaceted and personalized, and finding the right combination can make a significant difference in one's journey. Now, let's talk about trackable progress markers. These are essential because they give us concrete ways to see how we're advancing toward our goals. When we say they should be measurable, that means we need clear criteria to evaluate progress. So instead of vague ideas, we have specific numbers or indicators to track. Next, we want our objectives to be clear and focused. This helps us stay on the right path without getting distracted. The goals should be specific, meaning they define exactly what we want to achieve. This is where SMART goal setting comes into play. Remember, SMART stands for specific, measurable, achievable, relevant, and time-bound. By following these principles, we set ourselves up for success. Overall, these concepts are about making our goals concrete and actionable, which is crucial for maintaining momentum and ensuring we're moving in the right direction. Maintaining consistent sleep, meals, and hygiene routines is actually a powerful way to reduce recovery anxiety. When our daily habits are stable, it helps create a sense of control and normalcy, which can be incredibly comforting during challenging times. Think of it as laying a solid foundation for stability. Having a routine and a clear daily structure provides predictability, making it easier to manage stress and uncertainties. It's about establishing small, manageable habits that support both physical and mental well-being. By sticking to regular sleep schedules, eating nutritious meals at consistent times, and maintaining good hygiene, we reinforce a sense of normalcy. This consistency not only promotes recovery, but also boosts confidence in our ability to handle daily life. Overall, these routines are more than just habits. They're essential tools for fostering resilience and stability, helping us navigate the ups and downs with a bit more ease. Building the client's belief in their ability to succeed is such a crucial part of our work. When we talk about self-efficacy, we're really focusing on how confident a person feels about their capacity to achieve their goals. This confidence influences not just their motivation, but also their persistence when faced with challenges. It's important to understand that self-efficacy isn't something we're born with. It's something we develop through experiences. When clients succeed at small tasks, it boosts their belief that they can handle bigger challenges down the line. Conversely, repeated setbacks can undermine that confidence, which is why our role is to support and reinforce their belief in themselves. Throughout our process, we want to highlight their strengths, celebrate their progress, and help them see that they have the skills and resources to succeed. This belief in their own ability is what ultimately drives sustained effort and resilience. Remember, our goal is to build this self-efficacy so that clients feel empowered and ready to take on new challenges confidently. That's what will help them truly succeed in the long run. Maintaining compassion is really essential as we navigate this journey. It's important to be gentle with ourselves and others, recognizing that setbacks are a normal part of recovery. When challenges arise, we need to be flexible and willing to adjust the plan as needed. Sometimes what worked before might need tweaking, and that's okay. Identifying warning signs early can make a big difference. These are the cues that indicate we might be heading toward a relapse. When we recognize these signs, we can intervene sooner and stay on track. And here's a key point. Relapse is often part of the process, not a failure. It doesn't mean we've lost everything. Instead, it's an opportunity to learn and grow. Every setback can teach us something valuable about ourselves and what we need to do differently moving forward. So, viewing relapse as a form of learning helps us stay resilient. It keeps us focused on progress, not perfection, and reminds us that setbacks are just a step in the overall journey toward lasting change. Now, let's take a closer look at some high-risk environments. These are situations where the likelihood of someone experiencing a crisis or making a harmful decision is much higher. Factors such as lapses in routine can really contribute to this, as they often disrupt normal patterns and can lead to confusion or poor judgment. Emotional distress is another critical element. When someone is overwhelmed by feelings like sadness, anger, or anxiety, their ability to think clearly can be compromised. Increased isolation is also a significant risk factor. When individuals feel cut off from support or connection, they may become more vulnerable. It's important to be aware of warning signs in these environments. Recognizing these signs early can make a huge difference in preventing escalation. Keep in mind that these risk factors are interconnected and often overlap, so staying vigilant and attentive can help us intervene before situations escalate. Remember, understanding these key points fits into our overall goal of creating safer, more supportive environments for everyone. Let's talk about mindfulness, distraction, and support activation in the context of craving management. When we're working to manage cravings, mindfulness is a powerful tool because it helps us become more aware of what we're experiencing in the moment. Instead of reacting automatically, we can observe our thoughts, feelings, and physical sensations with curiosity and without judgment. Distraction can also be useful at times, especially when a craving feels overwhelming. Redirecting your attention to a different activity or thought can help reduce the intensity of the craving. But it's important to remember that distraction isn't about avoiding the craving forever. It's about giving yourself space to pause and breathe. Support activation is another key element. This involves reaching out or engaging with your support system, whether that's a friend, a support group, or a therapist. Activation of support helps reinforce your motivation and provides additional resources to help you stay on track. Connecting these ideas back to the overall theme, managing cravings isn't about willpower alone. It's about cultivating mindfulness, using distraction wisely, and activating your support network to create a more balanced, sustainable approach to change. Each of these strategies works together to help you respond thoughtfully rather than react impulsively. Let's talk about progress tracking, which is a crucial part of staying on course. When we regularly check in, whether daily or weekly, we can see how we're progressing toward our goals. This keeps us motivated and allows us to make adjustments as needed. Daily check-ins are especially effective because they create a consistent habit of reflection. They help us identify small wins and address challenges early on, rather than letting issues pile up. Accountability plans also play a key role here. These are strategies we put in place to hold ourselves or others responsible for staying on track. Whether it's sharing goals with a partner or setting up reminders, accountability keeps us committed and focused. Together, these tools, progress tracking, daily check-ins, and accountability plans, are essential for maintaining momentum and ensuring we move steadily toward our bigger objectives. They connect to the overall theme of sustained success through consistent effort and self-awareness. Let's talk about how to handle setbacks effectively. First, it's important to analyze the trigger. Try to understand what caused the setback in the first place. This helps us identify patterns and avoid similar situations in the future. Next, focus on re-engagement. Instead of dwelling on the mistake, gently guide yourself back to your goals and positive actions. Remember, avoiding shame and blame is crucial. Harsh self-criticism only makes things worse. When setbacks happen, respond with compassion. Treat yourself with kindness and understanding. This compassionate response fosters resilience and keeps you motivated to move forward. Overall, the key is to approach setbacks as opportunities for growth, not as failures, and to maintain a gentle, supportive attitude throughout the process. Let's now talk about the risk of burnout, which is a significant concern in support work. One of the key factors contributing to this risk is the high level of emotional labor involved. Support professionals often have to manage their own emotions while also responding to the emotional needs of those they help. It's not just about technical skills, it's about being emotionally present and supportive. Another important point is witnessing suffering. Seeing people go through difficult times can take an emotional toll over time, especially when support workers see repeated cases of hardship and distress. It's a heavy emotional load to carry. Support work is inherently intense. It demands a lot from those involved, both in terms of mental energy and emotional resilience. The emotional demands are substantial, requiring support workers to stay compassionate and patient, sometimes in very challenging situations. All of these factors, the emotional labor, witnessing suffering, and the overall intensity, highlight how emotionally demanding this work can be. Recognizing these challenges is crucial for understanding how we can better support those in support roles and prevent burnout. Now, let's talk about recognizing secondary trauma and emotional exhaustion, which are often linked to what we call compassion fatigue. Compassion fatigue is a state that can develop when we're constantly caring for others who are suffering. It's more than just feeling tired. It's a kind of emotional depletion that can impact our ability to empathize and connect. It's important to be aware of the signs, like feeling overwhelmed, detached, or even numb after a long day of supporting others. Recognizing these signs early is crucial because it helps us take steps to protect our well-being. By understanding compassion fatigue, we're better equipped to maintain a healthy balance between caring for others and taking care of ourselves. This awareness is a key part of staying resilient and ensuring that we can continue to provide support without sacrificing our own mental health. Remember, recognizing these signs is an essential step in managing secondary trauma and maintaining overall emotional health. Let's now focus on the importance of maintaining physical health, mental wellness, and establishing clear digital boundaries. These elements are crucial for our overall well-being and professional sustainability. When we prioritize our physical health, we're better equipped to handle the stresses of our work and personal lives. Mental wellness, on the other hand, helps us stay resilient and focused, preventing burnout. And setting digital boundaries is essential in today's connected world. It helps us create a healthy work-life balance and prevents digital fatigue. Incorporating self-care strategies into our routines supports these areas, ensuring we stay energized and motivated. Ultimately, taking care of ourselves in these ways is not just about personal health. It's a vital part of sustaining a successful and fulfilling professional life. Let's talk about supervision and peer consultation as essential components of professional support. These elements are crucial because they help us maintain high standards in our work and ensure we're providing the best possible support. Supervision involves regular, structured check-ins with a more experienced professional who can offer guidance, feedback, and accountability. It's a safe space to discuss challenges, reflect on practices, and grow your skills. Peer consultation, on the other hand, encourages collaboration with colleagues, sharing insights, and learning from each other's experiences. Both of these support systems foster continuous improvement and resilience in our practice. Remember, seeking supervision and engaging in peer consultation are vital not just for personal growth, but also for maintaining ethical and effective service delivery. They connect directly to our overall goal of providing quality, client-centered support that is grounded in ongoing learning and professional development. Let's take a closer look at the RAIN method, which is a powerful approach to building emotional resilience. The first step is recognize. This means becoming aware of what you're feeling in the moment, acknowledging your emotions without judgment. The next step is allow, where you give yourself permission to experience these feelings fully without trying to suppress or ignore them. Then comes investigate, which involves gently exploring your emotions, asking yourself why you're feeling this way and what it might be trying to tell you. Finally, nurture is about responding to your emotions with kindness and compassion, supporting yourself through understanding and care. Together, these steps help us manage our emotional responses more effectively, fostering resilience. This method ties into our overall theme of emotional health by offering a practical, mindful way to navigate our feelings, especially during challenging times. Remember, resilience isn't about avoiding difficult emotions. It's about learning to handle them with awareness and kindness. Now, let's look at some practical applications of what we've discussed. On this slide, we focus on relapse intervention, family conflict, and dual diagnosis practice. These are critical areas where applying our knowledge can truly make a difference. We'll explore case studies and real-world scenarios to see how these concepts work in real life. When it comes to relapse intervention, understanding the triggers and having effective strategies in place is essential. Family conflict often plays a significant role in both relapse and ongoing challenges, so addressing communication and dynamics is key. For dual diagnosis, recognizing the interplay between mental health and substance use helps us tailor more effective treatment plans. By examining these case studies and scenarios, we can deepen our understanding and see how theory translates into practice. This approach not only reinforces our learning, but also prepares us to handle complex situations confidently. Remember, the goal is to integrate these concepts seamlessly into our overall practice to support individuals on their recovery journey. Let's take a moment to discuss some key components that support our overall security and accountability. First, confidentiality protocols are essential. They help us protect sensitive information from unauthorized access. It's important that everyone understands and follows these protocols to maintain trust and legal compliance. Next, incident reporting is a critical part of our process. When something unusual happens or a breach occurs, reporting it promptly allows us to respond quickly and effectively, minimizing potential damage. It's all about creating a culture of transparency and proactive management. Progress tracking is also vital. By monitoring how we're advancing with our security measures and protocols, we can identify areas for improvement and ensure we're meeting our goals. It helps keep us accountable and focused on continuous enhancement. Finally, thorough documentation ties everything together. Keeping accurate records of incidents, procedures, and progress not only supports compliance, but also provides valuable insights for ongoing improvements. Altogether, these elements, confidentiality, incident reporting, progress tracking, and documentation, form the backbone of a robust security framework that aligns with our overall commitment to safeguarding information and maintaining integrity. Let's take a moment to recognize the importance of the people involved in providing comprehensive care. Family members play a crucial role. They offer support, understanding, and continuity that's vital for the individual's well-being. Case managers are also key players. They coordinate services, navigate resources, and ensure that every aspect of care aligns with the person's needs. Therapists and doctors contribute specialized expertise, working together to address both the mental and physical health aspects, creating a more holistic approach. All of these roles come together through collaboration, which is essential for delivering truly holistic care. This teamwork is often organized into multidisciplinary teams, where different professionals bring their unique skills to the table. By working together seamlessly, these teams can develop more effective, personalized care plans that consider every facet of the individual's health and support system. And that's really what this whole presentation is about: building integrated, compassionate care that puts the person at the center. Now, let's look at some of the independent companion services available. These are the services provided by private practitioners, offering personalized support outside of larger organizations. They often allow for more flexibility and tailored care. We also have treatment centers and NGOs, which play a vital role in delivering specialized care and reaching underserved communities. These organizations often have dedicated programs designed to meet specific needs and can provide comprehensive support. Agency work is another key area. Many professionals find rewarding careers working through agencies, which can offer diverse opportunities and exposure to different settings. Finally, there are various career pathways in this field. Whether you're interested in clinical practice, program management, or advocacy, there are numerous routes to build a meaningful career. All these options highlight the diverse landscape of opportunities available, emphasizing the importance of choosing a path that aligns with your skills and passions as we continue to focus on expanding access and improving quality of care. Let's talk about some of the key certification requirements that are essential in our field. First, licensing is a critical component. It's what officially allows us to practice legally and ensures we're meeting the necessary standards. Understanding legal risks is also vital. We need to be aware of potential legal pitfalls and how they can impact our practice. Liability is another important aspect. Knowing where our responsibilities lie and how to manage risks helps us protect ourselves and our clients. Lastly, we must always keep in mind the legal and ethical standards that guide our work. Upholding these principles is fundamental to maintaining trust and professionalism in everything we do. When we connect all these points, it reinforces the overall theme that staying compliant and ethically sound isn't just about rules. It's about delivering quality care responsibly. Let's take a moment to talk about risk assessment. This is a crucial step where we evaluate potential dangers and identify situations that might escalate. By understanding the risks early on, we can prepare and respond more effectively, ensuring everyone's safety. Next, we have emergency protocols. These are the established procedures we follow when an urgent situation arises. Having clear protocols helps us act quickly and confidently, minimizing harm and maintaining order. De-escalation skills are also essential. This involves techniques to calm tense situations before they escalate further. Using active listening, maintaining a calm demeanor, and showing empathy can make a huge difference in resolving conflicts peacefully. Finally, crisis intervention is about providing immediate support during a crisis. This requires specialized training to manage high-stress scenarios, ensuring safety while addressing the individual's needs effectively. All of these elements, risk assessment, emergency protocols, de-escalation, and crisis intervention, are interconnected. They form a comprehensive approach to managing challenging situations, aligning with our overall goal of creating a safe and supportive environment for everyone. Let's talk about client relationship management, which is fundamental to building a successful practice. Maintaining strong, trusting relationships with your clients not only encourages loyalty, but also opens doors for referrals and repeat business. It's about being proactive, attentive, and genuinely interested in their needs. Retention is another crucial element. Retaining clients over time means providing consistent value and excellent service so they see you as their go-to advisor. This stability is key to long-term growth. Professional networking also plays a vital role. Building a network of contacts, whether they are colleagues, industry peers, or other professionals, can lead to valuable opportunities and insights. Networking helps you stay informed and visible within your community. Marketing, of course, ties everything together. Effective marketing strategies ensure that your practice remains top of mind for potential and existing clients. It's about communicating your value proposition clearly and consistently. All these points, client relationships, retention, networking, and marketing, are interconnected. Together, they form the foundation of building your practice. When managed well, they help you grow sustainably and establish a reputation of trust and professionalism. Thank you for joining me as we come to the final slide of this journey. Here, I want to emphasize our deep commitment to lifelong learning and compassionate service. These are the guiding principles that shape who we are and how we continue to grow. Our journey truly begins now, with a launch into new opportunities and challenges. Striving for professional excellence is at the heart of everything we do, ensuring we serve with the highest standards. Remember, this isn't just the end. It's the start of a lifelong pursuit of knowledge, compassion, and dedication. Together, we're setting the foundation for a meaningful and impactful future.